Thank you. As Don has alluded to, we've made real progress to date in the control of neglected tropical diseases. And I would like to propose the very simple question, how do we track it? But as Her Royal Highness alluded to, that actually the answer to that question is somewhat complicated. But I want to try in the next 15 minutes identify some of the issues that we might want to consider when we are tracking the progress of these diseases. So neglected tropical diseases, as many of you know, are a term referred to a cluster of diseases that affect neglected, impoverished populations living at the periphery of health systems. They're caused by a variety of parasites, bacterium, and viruses, and they manifest themselves in a whole multitude of clinical disease, but also they impact on communities' education, their productivity, and cause social stigma. And indeed, the Royal Society of Hygiene and Tropical Medicine was established to tackle some of these diseases. At the time, they were not neglected tropical diseases. They were diseases faced by people living overseas. And in fact, some of the diseases themselves are named after previous presidents and fellows of this august society. These diseases are incredibly widespread across the world. If we take just two examples, soil-transmitted helminths, these were diseases that occurred in America and in Europe, but we've now got rid of them. But they occur throughout much of the world. So these are global problems, but they are also diseases that are incredibly focal. And if you look at filariasis, lymphatic filariasis, the distribution of that is very focal from community to community, which means that we need to have a good understanding of where these diseases occur to be able to intervene, but also to evaluate the impact. We are fortunate, as Professor Bundy mentioned, that we have a suite of tools that can effectively control these diseases. The mainstay is mass drug administration, using drugs freely provided by the pharmaceutical industry and delivered either through school or community systems. But to ensure long-term sustainability, these programs need to be supported by other interventions. For example, trachoma can be treated by antibiotics, but to have a long-term impact, we need to have improvements in water and sanitation. And it's very appropriate that the Queen Elizabeth Diamond Jubilee Trust is supporting the elimination of trachoma that involves MDA, but also support of water and sanitation as well. A real turning point in the control of these diseases was in 2012, when in London partners met to establish the London Declaration. And at the same time, the World Health Organization launched its roadmap, which identified a number of goals to eliminate and control 10 of the different NTDs. And here I give an example of the goals given for 5 of the diseases, from trachoma to soil-transmitted helminths. These range from eliminating and also to control the morbidity of it as well. So the question is, how do we track the progress towards these 2020 goals? How do we ensure that countries are meeting their targets, that partners are meeting their targets to eventually eliminate and control these diseases? Well, in answering these questions, I'm actually going to sort of set out a whole series of other questions. First, for whom are we measuring progress for? Second, why are we actually wanting to measure progress in the control of these diseases? Third, what do we want to measure? And then finally, what are the technical and practical considerations that we want to take into account when measuring them? And in answering these questions, I think it's useful to think about the different scales that we're working at, from the global level down to the neglected communities that we are actually concerned about, and why all of us are working towards eliminating these diseases. So if we look at the global stage, the principal audience are funders, governments and their voters who provide funds, and also international organizations such as the World Health Organization, the World Bank. And they are crucially interested in the amount of funding available for the control of these diseases. They want to know the global treatment coverage of the different programs. By necessity, they're not able to undertake a detailed analysis of the impact of these interventions because it's very expensive and difficult to do at a global scale. However, we do have broad metrics like the disability adjusted life years to be able to look at crude changes in relation to other diseases. As part of the London Declaration, we have the NTDs scorecard, which is providing a global annual assessment of progress. But in all of these global assessments of how we track progress, there's a number of issues. First of all, the data must be made freely available so anyone can take a look at it. Second, it needs to be regularly updated. Data from 2008 is not very useful for discussion about 2015. We need to have comparable indicators across diseases and across countries so we can benchmark and track progress. And crucially, these data need to be relevant and understood by the countries and the communities themselves. There's no point having highly technical information available if it's not of use to the people who are affected by these diseases. Moving on to the country level, here we're probably interested in knowing the health and the economic impact of these interventions. And it's useful to make the distinction between monitoring the impact, using very rigorous approaches, and monitoring the performance and the process of the programs, where we might want to look at how the interventions are delivered, how much they're costing, how acceptable they are to communities, so we can fine-tune programs to see whether they're not working, to improve them, to adjust them as well. And in that, there's going to be a balance between wanting to have a scientific rigor and also wanting to have affordable and routine evaluation of these programs. Crucially, the data assembled needs to be disseminated in an appropriate format to the varied stakeholders. And crucially, at the national level, we want to have district or subnational data, and that will enable us to look at the variation in the impact of programs across country. And that's useful for the communities themselves, so they can benchmark themselves against other communities within a country. So a certain district can see how they're doing compared to the national average, but seeing how they're doing about compared to their neighbours. And that will coalesce support for the control within their communities and within their country as well. The third level I want to focus is actually the community themselves. They want to see a tangible improvement in their health and well-being. They want to see that they're benefiting from these interventions and that they are acceptable to these communities as well. And that requires dialogue, involvement with the communities, presenting information in an easily understood and relevant way. And again, benchmarking is very important because humans are always comparing ourselves to each other, and we want to know how communities are comparing amongst themselves. In addressing all of these levels, I want to identify a number of key requirements for the rigorous evaluation of the progress made in the control. And particularly for neglected tropical diseases, we want to have adequate diagnoses. That these diseases, we want to be able to identify who's infected, who has disease. And there's a trade-off here between having very reliable and sophisticated diagnostics but are expensive, and having cheap, affordable, and might be sufficient for the purpose in hand. Second, we need to give due attention to the sampling that we are undertaking in terms of how we identify individuals for the selection of surveys. And crucially, we need to understand how much these surveys cost. Within veterinary epidemiology, they put a lot of effort on working out how much it costs to diagnose a particular infection and how that compares to other approaches. Third, we need to ensure that the data is timely, transparent, and widely available. And lastly, and crucially, we need to ensure that we're using this information to be able to have practical action, that we're not just collecting the information for the sake of it, we're using the information to be able to improve the programs to have tangible impacts on people's well-being and health. And as a sort of researcher, as an epidemiologist, in terms of neglected tropical diseases, I would like to identify 4 key issues moving forward, moving the science of monitoring and evaluation. And the first is that we need to understand the costs of these approaches, and are they appropriate and are they effective? And the whole cost effectiveness of diagnosis and sampling of populations, I believe, is a very under-investigated area and something we should give more attention to. Neglected tropical diseases have tremendous variation in time and space, and we need to, in our surveillance approaches, take those heterogeneities into account. Because if we don't have appropriate systems, we're going to miss the variation. So we might think that we've been able to eliminate or control a disease, but in fact we haven't done fine enough sampling to be able to detect them. Second, we have a tremendous understanding of the geographical variation of these diseases, and we need to be able to link that geographical intelligence to the surveillance data in a real time, and we can use mobile technology and computers and cloud technology to be able to link data collection in the field to maps to be able to provide us with an updated picture of the situation, and in turn that can provide feedback into programs. And lastly, and probably most importantly, we need to make sure that the data is being used by the different partners, whether it's at the global level in terms of accountability and value for money, or at the country level in terms of lobbying to show how the impact of these programs have been, and then finally at the community level as well. And that's a non-trivial activity, and I think as scientists, as epidemiologists, researchers, we need to have greater engagement with the end users of the data that we're collecting. Quite often we stop at producing a paper and move on to the next piece of work. We need to have that continual dialogue. And I just want to sort of highlight some more of our recent work that we've been doing in our group in London in trying to move forward the surveillance of soil transmitted helminths. And I just want to illustrate 3 pieces of work trying to better understand the variation in the different diagnostic methods that we have to detect these infections, and using Bayesian latent class analysis to give an estimate of uncertainty. We can also look at the different sampling platforms of how it can give us a true estimate of the prevalence of infection, how that compares to the spatial scale of surveying and pre and post treatment, and crucially the cost that it takes to detect a case of infection or disease, and how that varies as a function of prevalence. And the crucial message here is that actually the lower the infection gets, the more expensive it's going to be to undertake surveillance and monitoring and evaluation. So if there's a key message that I want to convey in terms of monitoring progress in the control of NTDs, is that we need to have a rigorous platform and approach that takes into account the heterogeneities and also takes into account the cost effectiveness, because in terms of sustainable mechanisms we need to ensure that we have affordable but also robust approaches to the work. So thank you very much.